Welcome, all you unhinged essentials.
I'm Cole.
And I'm Reed. Buckle up and helmets on.
And put those big girl panties on, because you're going to need them.
Welcome back to another episode of Cuss Discuss. So, what you don't see behind the scenes is the amount of, like, stop, record, stop, edit, cut, no, don't, shit, fuck, all the things that happen. So now we're three interviews in, recordings, little like let's put a blurb here, let's filter that, let's put that here. Anyway, today is one that enrages, I think, both the pre-hospital and in-hospital people, from providers, techs, dispatchers, your unit clerk.
This is a big thing. This is a big issue, especially with healthcare.
And I wonder if it. So this is a newer state for me. Coming from Texas, and a big city in Texas, I feel like on the pre-hospital side, this was not as big of the abuse of the ER. So that's what we're talking about. Yeah. So, hey, welcome to our show.
Hello. Welcome. Glad to have you back.
Yeah, thanks for tuning back in.
Yes.
We are potentially going to rage on this one.
Yes, we'll try to be nice, but honestly, I mean, if you're a nurse, you work in an ER,
yeah,
you know exactly what we're talking about. I mean, I stubbed my toe.
Yeah.
And you're here because you did what? Did you break it? Did it fall off? Do you have it with you? Oh, it's still attached and it's just bruised a little?
And It's been 3 fucking months and you've already got a diagnosis and you've gone to urgent care and your primary care in another facility. Fuck off.
So Reed has a lot of issues with this. So I guess you can look at it in 2 ways, though. Yeah. It's a break.
Sure.
You're going to go and, oh, you poor toe. And then they're going to go home.
Yeah, so it's not the full workup. It's not for the in-hospital.
It's
for
simple.
A 911 person, pre-hospital, it's another freaking run. It's another freaking chart. And it's like, dude, you have 3 BMWs parked out in your driveway and you couldn't figure out how to drive your...
So, honestly, it probably affects paramedics.
Man, it hits
like the buses. It probably hits them a little harder because it's like, I was dead asleep and you're calling me because you jammed your finger? What?
Oh, you know what's even more exciting was in the flight world, we started having to fly to those hospitals that had 0 specialty and figured out a way to kick these people out. And ground EMS was like, yeah, we're not going to transport out of town. We have limited resources today. You're going to have to fly.
Are you serious?
I have flown a sore throat.
No.
I have flown a broken foot.
I would hate to get that bill.
Yeah. Holy cow. Well, and then, so if we're real talk cussing and discussing, that's the people who don't pay.
Yeah.
And so if you're a private EMS company transporting, good luck. If you're a hospital, good luck. If you're a helicopter service, good luck. But we have all these laws in place that say, oh, hey, guess what? They asked, we have to. Fucking thanks, Obama. Bush, Clinton, whoever, go all the way back. God bless. I
think like the go-to of this is we are overusing the ER or any kind of service like that. In hospital, whatever. Yeah. It's overused.
911 dispatchers.
I mean, and it probably wouldn't be such an issue if these people would come in and understand that, oh, I'm not going to die in the next 5 minutes. No, but this patient I just got is fixing to croak over, but your expectation is to be back immediately, be seen, and then get to go home on your merry way with your little walking shoe.
Yeah. So those people, that finite specific group of people that come in and go, hey, this is not an emergency, but I can't get into urgent care, it's a Sunday, we're in a rural area, and I want it's quick service. Well, number one, you're in an ER, so let's talk about national averages for ER visits. 4 hours. Door to
And
door.
that depends upon the provider that's working as well.
Correct. Yes, 100%.
Yeah.
But national average, 4 hours door to door. The moment you check in to the moment you check out, you're going to be there for 4 freaking hours, and you're checking in for your token. I don't know how many times it's for 911 at pre-hospital, it's showing up, and it is a chronic issue that they're having. But oh, my doctor's out of town on vacation. They don't want to work in the heat. They don't want to be here. They go to the beach somewhere and they hang out for a month. Don't mess with your chronic pain in the month of August. Right? Also, not during December either, because they're home with their family doing Christmas stuff.
And guys, we understand there are some chronic conditions that warrant coming to the ER. We 100% get that, and we respect that, and we want you to do that. But that's really not the issue. The issue is overcrowding the ER with stuck toes.
Mm-hmm.
Oh, I broke my toe this morning. Tape the damn thing together with the other one. That's all we're going to do. We ain't going to do nothing for it.
So here's my thing with the emergency department, and correct me if I'm wrong, because I'm still new. I'm not new to emergencies. I'm new to the ER.
Right. You're still learning. It's still a learning process.
Yeah, and I'm simple medic. Right. Picture reader, crayon eater.
Ish. Whatever. Nah.
But if you're coming to the ER, should it not be, if I don't, I'm risking life and limb?
I mean, that's, I think, what the purpose of the ER is. Yes.
Right.
Yes.
But it's turned into, if you're within however many yards of the property of the hospital, you have to be treated and seen.
Once you're on hospital property, you're our responsibility.
Correct.
Yes.
Even if it's for, I'm cold and I want a sandwich.
Yes.
That doesn't make sense to me.
Yes.
Make it make sense, because I'm going crazy.
Unfortunately, there's not a whole lot that I can do to make it sense. It's a law. It's just how our system works. It's
So
like
somebody that's never worked in the medical field generated a law, got it passed through all the places, and boom.
I can't say whether they were actually in the medical field. I don't know if that was. I don't know. I'm like,
You're making me feel bad.
no, I'm like, I think I'm just trying to make excuses. I don't know. I really don't know. So do I agree with coming in because I've had a cough for 3 days? No, I don't. I don't think that warrants an ER visit. I think like with these people who, I mean, I was told by a patient one time, well, this is my primary care. And I looked at him, I was like, no, it is not.
No.
This is never going to be a primary care. That's not the way an ER functions.
Yeah.
You go to a primary care to see the same provider every single visit.
Oh, I had somebody in front of me a month ago say, I'm at the doctor's office. Like, no, you're not. You're in an ER.
Big difference.
Huge difference. But so does bringing in rural medicine, is that a factor for like where we work?
So I have noticed I tend to change jobs. I didn't admit that. I have commitment issues, guys. Okay, so anyways,
But that's a nursing thing. Like my nurse has done the same thing.
Yeah, I mean, so like I've worked in numerous areas, so I've noticed like just I don't even know, last few years, probably longer, that it's harder and harder to get in to see a provider. Harder and harder. So you're like, God, I'm sick. I'm going to call my doctor. I'm going to make an appointment. And you call, and they're like, well, we can get you in 2.5 months, and you're like, what?
But I have a
What?
cold now.
Yeah, I'm sick now. So how do we fix this? We'll go to the urgent care. Well, then you go to an urgent care and you go in, you see their providers, and they're like, oh, we can't handle this. Go straight to the ER. And I feel
you
like
said
that's
difficulty breathing.
yes,
You need to go to the ER.
yes. So I don't think that our urgent cares and our primary cares are as effective as they used to be,
Yeah.
or maybe it's just that people are seeking those things more frequently than they did maybe in the past. Because
Sure.
I mean, I know when I was a kid, I could get in. Yes, I'm old. I could get in, no problem.
Yeah.
I remember going to my PCP when I broke my arm.
Yeah.
And they did the X-ray in the office, and they're like, "Oh, put it in the sling, he'll heal," and so on.
God bless for Gen Xers to go to the ER.
Yeah.
Holy crap! The level of death that need to be occurring.
Yeah.
To get you to the ER.
Yeah, I mean,
it was worse to call 911. I remember when 911 started.
I sadly don't.
Yeah, when it started. Remember the show came out, William Shatner, everything. We would gather around the TV and watch Rescue 911, 7 o'clock at night. I think it was on like Tuesdays or Thursdays.
Wow. I think I was a kid.
Yeah.
Yeah.
And you're just like, holy crap, look at these. And it was like a person that was like riding their four-wheeler and like drove their neck through a barbed wire fence.
Yeah.
That's what that's what we were taught to call 911 for.
Yeah.
And now these jokers are just going, yeah, I can't get into my doctor.
I don't even think I stepped foot into an ER until I was like probably high school.
Yeah.
And I didn't even go for myself. I went for somebody else.
Mm-hmm.
So, I mean, ER is, the emergency departments are way overused. I mean, for just clinical issues. And I get that people are scared when they hear, oh, shortness of breath. Go straight to the ER. Well, let's check some vital signs. Let's investigate that shortness of breath.
Yeah. Maybe you just need to hawk a loogie.
Yeah, I mean, maybe you're just really congested and you feel a little short of breath. I mean, some cough syrup and some steroids and you're going to be good to go.
Yeah.
You know, I mean, because typically that's what's going to end up happening. You come to the ER for your cough, it's like, okay, well, what's going on? Have you been running fevers? What's going on with it? You know what I mean? So, yes, the ER is 100% overused for issues that can be taken care of with your PCP or an urgent care.
Correct.
100%.
But we're also like uncovering that there's an issue with PCPs and urgent care. I feel like, especially in rural areas, urgent care has a lack of resources. They can't afford to pay a rad tech to come and do EMG.
Yeah.
And it turns into, well, in order to give you a diagnosis, since we have all these laws and regulations tagged on us as providers, we have to be able to do imaging, we have to be able to do lab. If we don't have either one of those, we have to send you to the next level of care. Therefore, go to the ER.
Right.
And then it's turning into just go to the ER.
Right. And, even now, like, money's hard, guys. That's hard to come by.
Mm-hmm.
I mean, people live paycheck to paycheck. And if you throw in a sick kid, or if you throw in, oh, God, I'm sick, I can't afford to miss work, and you don't have the money to pay an urgent care or your PCP, guess where you're going to go? You're going to go to the ER. It's like, sorry, I know I'm not urgent, but hey, I'm
and
here.
just not pay the bill and take a hit on your credit score.
Yeah,
you already have your house, no big deal.
Yeah, because you can't afford to pay those bills, and I get it. Yeah. But there's got to be alternatives. It's like if you have to skip a pack of cigarettes, guys.
Right there, you go. There you go.
Skip that bottle of liquor that you're going to buy later. That could go toward maybe your urgent care visit, or probably me shouldn't be saying those things, but it's just you have to prioritize. It's like, I get that you're sick, but is it so bad that you can't take care of it at home?
Yeah. Again, if you are not going to lose life and limb, do you need to go to the ER, the emergency room? That does not equate to fast treatment, especially now because God bless like me just being there. Um, the amount of sick people that I've had to say, "Hey, we don't have a room," because you're supposed to fill your rooms when patients come in, right? Fill
Yeah.
the rooms, make the times, you know, you hit all these matrices,
Yeah, I
right?
mean, there's certain things that we have to do, and we have to meet certain times, certain
Yeah.
expectations.
And then
I
boom,
mean,
you're full of clinical issues and not a single emergency.
yeah. And then when something emergent does come in, then you're scrambling. Oh God, okay, who can I move? Who doesn't need this? Who doesn't need that? And then you're
Yeah.
starting to move people out
Then
of
those
rooms.
people are pissed and throwing a fit. How dare you put me in a chair?
Yeah.
Like, well,
I mean, I get there's emergencies, and I think like with the ER, you see more of the non-emergent stuff.
yeah, I would say probably 88%.
Yeah, I mean, you get your emergencies, and believe me, we get, even being in a rural area, we get our emergencies.
Oh yeah,
But
Farmer Bob attacked by his bobcat and not the thing he drives.
yes,
Yeah.
or he's out there working his cows, and he ends up squished in the fence somewhere. It's like, oh,
Yeah.
hey, you're 90 years old. Why the hell are you out there
Well,
doing that?
we had 2 or 3 venomous snake bites the other day, and
Yeah, I mean,
we're almost rural.
Yeah,
You know,
I mean,
we're pretty rural.
we're having to do the anti venom, and we're having
Mhm.
to do all the things. I mean, it's. I think what makes it more difficult is when you're super busy and you have this. I feel down earlier and my knee hurts. Okay, guy, take some Tylenol, take some ibuprofen.
Oh man, you know what we had
Prop your leg up, put some ice packs on it.
I had a cough, but I'm better. I just want to come get checked out.
Wow.
I'm like, tell me one more time what happened. Well, I had this cough. How long did you have the cough? Probably 2 months. Okay, what'd you do? I took that Mucinex. Like Mucinex. Yeah, that stuff you get at the WalMarts, plural.
Oh.
Yeah. Okay.
Mind you, we only have one in town.
Yeah.
So.
Yeah. Plural. He's like, I'm good. My mom died of a blood clot. I just want to make sure I don't have one. So if I'm hearing you right, you're saying I have no problem right now. Oh yeah, man, I feel great. I'm just making sure that I feel good. And you decided to show up to the ER. Okay. I can't slow blink slow enough.
And the ESI level would be.
Yeah, 27. 20 freaking 7. Here's the other one that jacks with me that so me being new to the ER, you being seasoned in the ER.
Mm-hmm. Yeah.
Both of us seasoned people dealing with emergencies.
Yes.
Not knowing the type of care or what's provided at the hospital in your area. I feel like that's huge, especially in a rural area, right? So we're in Oklahoma.
Yes.
We have 2 children's facilities in the state.
Yes.
We have 2 level 1s, 1 level 2.
I'm not sure about the level 2s. I do know about
So
the
now,
2 level 1s.
so St. Francis is now just the level 2. So it used to be St. Francis and St. John's traded level 2, and then the St. John's became level 2 or level 1.
Yes.
Yeah, so they're level 1, OU's level 1, and now you have St. Francis Children's, you have OU Children's, and that's pretty much it.
Yeah.
So now you have all the community hospitals,
which are numerous. There are tons of them.
There's tons of them. They're anywhere from single story, 3-story, 4 or 5 story. They're essentially a 100-bed ER. They can deliver a baby. They may be able to do a cath lab. They can do some basic stroke stuff.
Yeah.
Minor, ortho, everything else, boom, sit out.
Yes.
The level of uneducation that exists, and not just in Oklahoma, but I think in every rural area.
I think it's every hospital. I don't think it's
Right.
just rural areas, but it might be worse in rural areas.
I think so, because like what I'm bringing up is like if people bringing their kids,
Yeah.
to a facility that does nothing with pediatrics, And then they just don't know. They see emergency on the side of the building, and they go, "You can take care of this."
Yes.
And you go, "Okay, well we can mitigate the death process for a while, but then we're going to have to send them somewhere else." And then that family is like, "What do you mean you can't just take it? Why do I have to go 100 miles away to do this, that, or the other?" It's like, well, so we don't have pediatricians here. We don't do this. We don't do that type of surgery. We don't have that kind of specialty. And so, how do you educate the public on what your resources are in your area?
Well, I mean, overall, like any ER can take a pediatric patient, right?
Right.
Any of them. So a lot of the problem you run into is like travel distance.
Mm-hmm.
You know, you compare our area to the bigger cities.
Sure.
They're a
A
drive.
Dallas, a Houston, a New Orleans.
They're a drive. You know, even our local is kind of a drive, especially when you don't have money. You know, you don't have a car that's gonna make it.
Can make it.
Yeah, you know,
45 minutes down the road.
There's things that you have to look at, and I get that and I understand that. You know, but if you're already driving to us from an area that you can get to a bigger city quicker, I would strongly suggest going to a bigger city. It's like, okay, look at your map. Okay, so this hospital's this far, this hospital. Oh, and they actually have pediatric services. Let's go to that one instead of going to the opposite direction. It's like, think about that. Or if you know that your child is sick, why not go ahead and take them to a pediatrician? Oh, I do have one.
There you go.
Medicate your damn child when they have a fever. What the hell? I don't need to see the damn fever.
You know how many times I've freaking heard, we just wanted you to know that her fever was 103.
Well, is that why she's having a seizure out in my waiting room?
Yeah.
Like, what? What?
She's got the shakes and the can't breathe. I feel like she's demon possessed. Somebody come out here. I'm like, girl, one, you need a priest.
Why are we not medicating our kids? Come on.
I did. I tried to tell my spouse this, that I felt like where we moved, big city of Dallas. There are more people that live in Dallas that live in our state.
Yeah.
You cannot spit without hitting a level 1. And you cannot fart in the wrong direction without hitting a specialist.
Yeah.
That is excited, taking patients, open, willing to go. You get in, you get out, you are rocking. And so we move up here to at the foot of, I've never had shoes before, and good luck on teeth. Granted, I love it. I never want to live anywhere else. The pendulum, like if I put it on the worth it scale or the weigh it scale, right? So you see like that, the judgment scale of like guilty, not guilty. Let's measure your sins versus your grace, right?
Yeah.
So if I make that a healthcare thing, so education versus what's available. I feel like the people here, one, are at a disadvantage because on 2 different levels, they don't have resources.
Yeah.
And that sucks. Because then it falls on a 5-bed ER with 2 nurses and a provider.
Yes.
Right?
Yeah.
And 0 specialties.
I think I worked in that hospital.
God bless. I cry for those people. I cry where I work too. I cried this morning.
And he's not even at work.
I know. Yeah. But then you also, so it's the lack of resources, and then it feels like there's no education. So I talked to my mother about this. And so West Texas. Right, and so I grew up in Lubbock, Texas. I'm a proud Red Raider, a proud Lubbockite. That's a relative for Texas. It's a small kind of like a mid-range.
Is it even Amarillo size?
Yeah. So
Okay,
there's
like
level
Amarillo.
1s like Amarillo, Lubbock.
Yeah.
There's some level 1s. You've got the University Medical Center there. You've got flight teams, EMS, ALS services, everything. We freaking knew when and where to go.
Yeah.
And we could go wherever we needed to go. You just made an appointment and you went. And so I think like post-COVID, my spouse just had to remind me that there's no longer any more 24-hour pharmacy.
No, none.
I was like, how in the frick are these people showing up? Because they're out of meds. God bless, call your fucking doctor and get your meds and go to freaking Walgreens. And she's like, yeah, it's Saturday and it's after 5.
Yeah, I mean, that's a big issue, especially on the weekends, especially in our area. There's nothing open. It's like you have to, I think, like maybe 1 or 2 of the pharmacies even open on Sunday, maybe, I think.
Yeah.
I don't even, God, I don't have to think about it.
Yeah, thanks,
like,
jerks.
Yeah, I mean, it's
like,
bad.
How can you not?
Yeah, like, we have to send, sometimes we'll have to send at least 1 or 2 doses home with a patient.
Yeah.
Just
to get them through the weekend.
Yeah, so that they can make it through the weekend and then they can go with their regular prescription.
Yeah.
Yeah.
And then just the level of not freaking knowing. How do you not know that your 4-month-long ankle pain that you've already seen everybody for is not going to change just because you came to this ER?
Or you heard it 4 months ago and you just decided
refuse to take care of it
at 2:00 in the morning on a Saturday morning. It's like, oh, this is important now.
Oh, you know what makes me feel good? You know what makes me like when I hear, hey, I was driving by and I saw that the parking lot wasn't that full.
Oh, wow.
So I thought I'd just pull on in and get a checkup.
That is so deceiving too.
Or
so deceiving.
I was upstairs visiting my mama that was here for a heart attack. And, I realized that, my heart's been hurting too. So I might as well just, go ahead and see what's wrong with it. Like, at that point, I need Jesus and my rosary. Because, like, I've got to pray. Because I just want to look at him and just be like, okay.
Sarah, can I have a moment? I'll be right back.
You do that thing like, let me check to see if your room's ready. Or the thing where it's like, my doctor told me to come up here and they said they was calling, so I should have a room. Not how an ER works. No, you get in line behind every other not sick person on the planet, and we'll get you there when we can.
So this reminds me,
Sorry, I'm shaking. I mean, we'll take a break.
It's kind of funny. So I had a patient check in, and I went up there. And it was a younger patient, and so their parent was there with them. And I was like, I called their name, and I brought them back, and I was like, so what are you here for? The doctor knows. Okay. And I'm like, can you tell me why you're here?
Yeah.
The doctor knows. Again, that doesn't help my situation. So again, can you tell me what you're here for? I already told you the doctor knows. I said, okay, so this is the way this is going to work. You're going to tell me why you're here so that I can do my job, and then I can let the doctor know that you're here and remind them of the reason you're here. Many ERs have signage up that says, do not assault your healthcare workers.
Yeah.
So this particular person looks at that sign and then looks at me and says, why do y'all have that sign posted? I was like, well, it's pretty obvious, don't you think? And he's like, yeah, pretty obvious.
Oh.
I was like,
you want to throw?
I was like, so I guess you're planning on kicking my ass right now.
You want to throw?
I don't know. It just reminded me of that.
Security.
I was like, I just looked at him and I was like, so are we going to start? Do I need to start dodging? Do I need to what do I need to do?
Bust a move.
I'm like, do I need to whoop your ass? What's going on?
I can't. It just, and I know, like, and you know who I feel the most pain for is when we're short-staffed and we have to bring down somebody from another department, and it turns into like the pediatric clinic for 4 hours.
Oh God!
And God forbid, usually the person that comes down ends up getting the low acuity rooms because they're not used to managing the ER, and we're trying to run interference for them. And if you're one of those people that just had to work in your ER, know that your triage people, your charge nurse, your director, they are doing everything they can to give you the easiest shift possible. Yeah. And thank you for coming to help out.
Yes, I mean, I applaud you for even volunteering or
Yeah.
being voluntold.
And not like shitting your pants and going, I'm sick, I have to go home.
Yeah.
Like, not going to the ER.
I mean, because I'm going to be honest with you, is they came down to me and I was in the ER and they look, you're going to go to med surg. I'm like, no.
Yeah.
I have minimal experience on med surg. I would be a catastrophe up there. It
So,
would be awful.
and then those people end up getting, like, the other day we had one, and that poor person, I think in the 12 hours I was there, it was like 25 patients, all level 4s.
Oh.
But bullshit after bullshit after bullshit after bullshit. This person could not come up for air. I felt like I was in an old school community swimming pool, just holding their head underwater.
Oh wow, that's terrible.
Because like I had a one-on-one, I had another critical. Everybody's just like, I can't even breathe, and I'm looking at this person going, "You going to learn today." Here we go. We're gonna train ride this one.
I realize you have 3 rooms, but you also have 6 chairs back there. Good luck.
Yeah. Boom, 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 boom. I'm gonna keep you full. We're gonna treat and eat as fast as we can.
Wow.
Sorry. At the same time, I'm looking at the patients that are coming in like you.
I think like the takeaway from this whole thing is the fact that people need to learn what's an actual emergency is.
Correct.
I mean, if you've had the issue for 2 weeks, can you just call your doctor? For a month that you've been having your toe pain, why did we not call immediately instead of waiting until 2 o'clock in the morning on a Saturday morning to come see the doctor?
Yeah. Or the ones that's like, I've already been to this hospital, but I didn't like what they said, so I'm coming here. Like, you think we're going to say something different?
I mean, in like asking for medical records in the ER from another facility is a whole nother issue because if you had scans and all the things done there, we want to see them. Mm-hmm. Because guess what? We don't want to scan you again.
No.
That is radiation. That is not good for your health.
Yeah.
So.
Or they're like, I had surgery at X hospital.
Yes.
And I'm having a post-surgical problem, so I'm here now.
Why did we not go back to this?
Did you call that surgeon?
Old facility?
No. Why didn't you call that surgeon? When did this problem start? Yesterday. Why are you here today? What? Because if the pain is still, or whatever, fill in the blank is still there. And I'm like, you do realize, like, let me tell all of you non-medical people, there is not a physician on the planet that is going to touch a surgeon's work.
No other surgeon will do anything to an already
surgical person.
Yes. It's just not going to happen.
Not happening.
They will never touch you.
Yeah. Well, I didn't like the way the nurse spoke to me on the phone. The tough shit, that's where you went. And that's their problem. Now, that surgeon owns what he did to you, and no one is going to touch it because of insurance and medical law.
Yes. I mean, because they can't be held liable for somebody else's work.
No. And they're not going to join in on the shit show that was started because you went to some cheap place.
Yes.
Yeah. Sorry about your bad luck.
I mean, because I get, oh God, this is bad. Like something bad happens with the surgical side. Mm-hmm. Get your butt in there. Get to an ER. Yes, absolutely. Yep. But if you have the option to go to the original facility that performed the procedure, go. Yeah. Go there.
Yeah. And any ER will stop a life. So I think that's the other education that needs to go out to our non-medical people.
Yeah.
So an ER, by design, stop the life threat, correct? Is there anything else on that? It's stop the life threat.
Yes, I mean...
Once the life threat is stopped and you are safe to go home, we will discharge you.
Yes. The expectation is not to be admitted.
Correct.
The expectation is to be able to go home and go see
that's
the
why
professionals.
Every education you get is follow up with your PCP or this specialist.
Yes.
Yes.
100%.
Also, if you run out of your Suboxone or your Percocets,
yeah,
any of your pain management stuff,
do not rely on the ER to refill them because it is not going to happen.
that's we're not gonna we're not even gonna refill a prescription. You come in because you're out of your Losartan.
Yeah.
All right, and it's a Saturday. I ran out of my Losartan. Why didn't you call your doctor when you realized you were 5 doses low on frickin' Monday and now it's Saturday? Oh, well, I was busy. Cool, I'll give you the benefit of the doubt. We're going to get you through the weekend.
I want to just look at them and say, we're busy too.
Yeah.
We are very busy.
Yeah, you do realize now this is an ER visit. My other favorite, I need an STD check.
Health department, guys. They do a great job.
Yeah.
Health department.
Yeah, go pee in a cup there.
Mm-hmm.
It's free.
They do the same job that we do
yeah.
when it comes to those things.
I need to check if I'm pregnant.
Oh, so there's a Dollar General just right down the road?
Yeah.
And you can get that pregnancy test for about $1.
Yeah. You can be on the same stick.
And guess what?
Yeah.
It's about the same accuracy.
God bless. What are the other ones? Oh, my favorite is I was in a car wreck and I refused EMS and now I'm sore. I'm like, okay, so that's...
Damn the luck.
Right. That's like the gray area. Are gray area patients like you want to be mad at them, but you can't?
Yeah. I mean, because there could actually be something wrong.
Yeah. You know how many times we had like a spleen black? Or the chick that came in that was like, my leg hurts because your fucking femur's broken. She's like, I've been walking on it for 3 days.
Okay, so I got to say, for those people, you are tough.
Yeah.
That's all I can say. And I'm not going to be bad at
I'm like, how long does your leg look like an alien was trying to rupture out of the side of it? God, man, I thought I could just walk it off. It's something like the country folk, like capital K country folks that walk in.
You have to admit, like some of the country people around here, they some tough people.
Yeah, but like, God bless education. Like, how do we educate them? I almost want to put a sign, like a billboard, out in front of the hospital, every hospital, that goes, "This is what we do."
If your issue does not reach within these guidelines, do not enter this facility.
This is what this word means. Because people are like, "What's the GIs? Is that government issued?" I'm like, "No, it's not. You can't shit right." God bless. And we don't do that here. We got to send you to another hospital. Why the hell I got to go to that hospital? I don't want to go to the big city. We'll do tough shit. No pun intended. God bless.
Or you get that special thing called a brown cow.
Yeah. Yeah. Let me just push that out. You're the king of the brown cow.
Oh, God. I swear to God.
If you have to do another one.
I'm going to be getting those grippy socks. I'm sorry. So, like a facility that I used to work at, they would do enemas until clear, and they would admit them upstairs. And so I didn't have to do any of them.
Yeah.
And now, like, if I get something, it's like, hey, can you do that brown cow? Oh, I don't want to do it.
How about
I swear to God, for 3 weeks straight, I did no less than 2 brown cows a week. A week!
I feel like for like a month, the only time I saw you, is like you were mixing all the
brown cows. Yeah. That's all I did.
It was awful.
Oh my God.
How about that? Here's the other one that drives me nuts is psych patients that come from a facility with medical professionals.
Oh, wow.
Right, so...
They're already where they're supposed to be. Why are they here?
No joke. Yeah, so you get a fill-in-the-blank assisted living, or you get, a psych house, something. They're like, well, they said they wanted to hurt themselves, so now they got to go to the ER. No, they actually don't. Y'all have
Y'all have the
exact
services.
same services that we are going to offer. You can get online. You can actually call their fucking provider and get a check done quicker than we can call Joe Blow from down the street,
Mm-hmm.
and you can set somebody in front of them to watch them.
A lot of it is like, I don't know if it's just our state, if it's just so, I don't know. I don't. So psychiatric care is, it's just not a thing here. It's like
No.
they stick them in an emergency department. They sit there for, I think the longest I've seen, especially with pediatric. Pediatric is hard to place.
Yeah.
And I've seen them sit in an ER for a week just waiting to go somewhere. And the psychiatric issues, there's a lot of them. And we end up with a lot of them. And they said our ER for hours, they're not getting any benefit out of it other than just laying there.
Yep.
And, it's like, if they start acting out, do we medicate them? Probably not appropriately. I mean, we have to knock them out because we don't have time to sit and hold them for 12 hours.
Yeah.
We can't hold them down and do that. We have other patients we're not dealing with.
Yeah, what are you going to, like, sedate into compliance?
Yeah, I mean, and and sadly enough, that's kind of the way it works. And so, is there a big, good answer for psychiatric care? If another state has it, we'd like to hear it.
Yeah, help us out.
Yeah, give
All
us
the
suggestions.
Yeah.
Yeah, we need it. Because,
God bless that.
I mean,
that drives me nuts. And then now that, like in our area, rural, so post COVID, if you want to call it, tariffs or Medicare changes, insurance policies, all the things that happen in Washington, D.C. that are filtering down to real folk in real places. And now you get hospitals closing, clinics closing. We've already discussed our urgent cares can't do things. You can't go to your PCP because they're overworked. It's just one person that's been there for 27 years, and he's got 11 patients, and they're coming in, Monday through Friday, 8 to 5 every day. And like, can't take a new one, and you're not backfilling the doctors, providers, the specialists that are retiring.
Yeah.
And so now we have a shortage issue. And so not only do you have the psych issues, you have the overuse of the ER, you have the lack of education, you have the rural hospitals that you can't get anywhere for any kind of specialty care.
And some of the hospitals closing down.
Absolutely.
Wow. It's, for the staff of the ER, it's hard. I mean, it really is, because you're overloaded with patients. Staffing isn't always great. I mean, it's really not. I mean, like, I don't even know. It's just like with our census, it's double.
Oh, yeah.
I mean,
absolutely.
Even for night shift. And night shift does not have as many nurses or...
Zero of the resources that happen from 7 A to 7 P.
Yes. I mean, and really our resources are limited after 11 o'clock. So we only have a few hands in there to cover an ER, and you have all the same amount of patients. I mean, is our census as much as days? No. But for the amount of staff to function, we need more. So,
yeah, I think the comparison is not accurate, because y'all could absolutely be asked to do just as much with less. Because it's not like you can just go, oh, well, my administration's here, I can call them down because they're still licensed.
Right.
I can call in another, okay, everybody's up, I can call them in and they can come and sit for a second or do this or whatever.
I mean, normal people are in bed asleep at midnight. So, it's
so you're sitting out the text blast, we need help, and nobody sees it until they wake up at 7 o'clock in the morning.
Sorry for your bad luck, I just got up, So,
do you still need help? 5 hours later.
Yeah, it's like, well, no, so everybody's still alive, so we're in good shape.
Yeah.
So, I mean, it's just, it gets very stressful. It's very hard. I mean, You just and Lord forbid if you have to have a one-on-one. I mean, like psych patients, you have to have somebody with them.
Mm-hmm.
So that means we lose a tech. Oh, there's two more hands gone.
Well, I've seen it on night shift recently where there's been two psych patients. So now you need an extra tech or you lose one of your hands.
Well, and that's recently happened. I had a psych patient check in, and guess what? We
and
didn't have nobody to watch. So
you have a postcode
yeah.
intubated patient.
Yeah.
And then you have a conscious sedation. And then you have EMS coming three back to back to back.
Yeah.
I've seen that before, and I'm like, I'm out the door. I need to leave.
Mm-hmm.
You know, I've been here for 12. Our other provider's been here for 12.
Yep.
You know, this person's been here for 12, and we're deuce it. Like,
it's time to go home.
Sorry,
that's
sorry. Yeah. Like we just got, you know, our butts kicked for 12 hours, and y'all are like, can y'all just stay for another 3 or 4?
Yeah.
Like, no, I got to be back at 12.
It's like, no, I'm going to go on home.
Yeah.
I'm going to go chill.
Not my problem. You know, so that's what's hard too. And you have all these variables that I'm learning that is driving me crazy. Because when I first started, I was nice, and then I kind of started getting in the know, and was just angry. I think I was angry for a year.
Mm-hmm.
I got full year.
I could see that.
I was pissed.
Yeah.
I'm like, why are you? How is this? What is this? You know, there's a better way to do this, and there's really not. I think like all the rules and laws and policies and procedures and all the things that have been put in place screwed the people that actually have to do it.
It did. I can say I feel like it did. I mean, because I get that you want to make your patients happy. You want to do everything you can for them. But
what is that score? The freaking piece of paper that we have to have them fill out.
Oh God!
Like, I'm not here for your happiness or for you to eat or for something else. You're here for an emergency. Get out the door.
I mean, a lot of it is like
also Mark 5s on everything.
Yeah. So a lot of it is like you're not going to be able to make every patient happy. It's impossible. I mean, you might be able to get a few of them be like, "You're doing such a great job," and when you hear that, it's like, "Thank you so much."
Yeah, I can make it another 5 minutes.
Yeah, I'm like, okay, that was a little bit of a refresh. I can go on. I can move on. Let's move to Miss Hateful over in room 10.
Yeah.
Oh, hey, you hate me still. Thanks. Love you too. It sucks. It just sucks. And so, like these scores that we have to meet, I'm never going to resolve everybody's pain. It's not going to happen.
No, the scores, the time frames.
Yeah.
None of it makes sense.
I mean, the expectations are almost, you have to be a robot, and that's all you do. You don't eat, you don't drink, you don't poop, you don't pee. You just work.
Yeah.
And you work, and you work, and you work. And
do you have an idea for like the education? So I am certain that some of the people that are just randomly clicking, they hear Unhinged Essentials or read Unhinged Essentials, on some podcast forum, which by the way, all of them.
Yes.
So
yeah, check it out.
Yeah, go to all of them. We have socials too. Unhinged Essentials. Just Google, you'll find us.
Yeah. Facebook.
We are Googleable.
We
are Alexable.
Yes, Alexable. Yes. I was so excited.
So go to those. Shameless plug. What do we say our Cuss Discuss to the people who don't know?
I mean, guys, just try. Try to get a hold of your PCP. Try to get into urgent care. And honestly, when you go and they send you to the ER, there's not a thing you can do about it. And we get that. And we understand that.
Don't Google your symptoms.
Oh, God, don't.
But
you're going to have cancer and you're fixing to die. Get to the ER immediately.
Yeah, everybody has AIDS. Everybody has cancer.
Yes.
Yeah.
Don't.
So Google treatment for symptoms because that is helpful.
I have never tried that.
You can Google, so if you like, what do I take for a cough?
Okay.
Right. So it'll give you all the things that Walmart offers.
Yeah, and if there's something you can't take, there's alternatives. Generally.
Also, we're not giving medical advice. Please follow the medical advice of your doctor.
Yes, 100%.
However,
we are not providers.
Yeah, use your damn brain. If you have a sore throat, I like Cepacol. That's my personal recommendation. I like Cepacol.
That's the cough drop. Right?
Yeah, it tastes good and it numbs my throat.
And it actually does a pretty good job.
It does a wonderful job.
Yeah.
There's nothing better than a hottie toddy for cough and congestion. In my non-medical professional opinion, there's nothing better than a hottie toddy. And you can Google hottie toddy.
You're welcome.
But man, for viral symptoms, like runny nose, cough, chills, fever, body aches, give it a chance. Just know that if you take one round of Tylenol, it's not going to cure you.
No. And just a little side note here. Antibiotics does not fix viruses.
Correct.
Sorry.
Yeah. Also, viruses, 2 weeks. That's 14 days. 1-4. You can also re-give yourself the virus.
Be clean.
Yeah. Wash your hands. Stop picking your nose.
If you cough, don't cough without covering your face. You're going to give it to other people.
So, there's that. Also, look up the hospitals in your area and figure out what they offer because that's listed.
Yeah, you really need to know that because those certain things that you need isn't offered in every hospital.
And there's nothing worse than getting that surprise bill. I went to this hospital, was transferred, and got a hospital bill. So you got 2 ER bills, a transfer bill. God forbid you got a flight bill.
Oh Lord! And
you weren't on flight insurance.
Cheap.
Yeah,
not cheap.
Also, Google your flight insurance. Get on that because that is cheap to get, and that will save you in the long run.
Oh yeah,
especially in a rural area.
Thousands and thousands and thousands
of dollars.
Yes.
Yeah. So absolutely do that. So how about our people that work in the field like I do? And I'm just pissed. What is the best way to get through it? I feel like my spouse does a good job with it, but I don't get that like education from them. So the people who work in the field, new in the field, like our Sunny D's that are out there, what do we say to them to help them feel good about continuing to do their job where they're just getting their, face punched in all day long?
I think it's just something that you have to learn to deal with.
Yeah.
I really don't have good advice for it. I mean, I'm not rude to any of my patients. They come back for their little toe pain. Oh, how did you hurt your toe? Oh, it looks ugly. That's just my personality. I can't do that. That's just me. I do everything I can not to be rude until you.
When you got to protect yourself, you're going to protect yourself.
Yes, I mean, otherwise, if you're just the sweetest person in the world and you jammed your finger, oh, I hate when that happens. It hurts. I'm like, how'd you do it? What happened? Let me give you a towel.
Yeah.
I try to be nice. Now, when I come out of the room, it doesn't say what I'm saying when I walk out.
This is my face, and this is what it means.
Yes.
Yeah.
So I'm going to be overly kind. It doesn't matter what the situation is.
Mm-hmm. Well, thanks for letting me cuss and discuss this issue. This was Reed's issue. This is mine. I'm learning the in-hospital emergency room area, and it is making me crazy. And that's especially so. I came from a fire department that did a whole bunch of public education.
Yeah,
we were huge on it. And so I know that there's an issue with rural settings. I know that there's an issue post-COVID. I know that there's issues with physicians retiring. And so if you're listening to this and you're in the hospital or out of the hospital environment, if you're a family member of whoever, just know that there is a whole bunch of issues, a whole bunch of things, and everybody's trying their best. And so if you get that cranky person, just know that you're probably the 15th non-emergency that day.
There's
Also,
a lot of them.
Yeah.
There's a lot of them.
Talk to your when you get in front of your provider, your actual primary care. Get all the education that you can.
And guys, understand the ER is not your PCP.
It is not.
We are not designed that way. We are not to function that way. And no, your favorite doctor in the emergency is not your PC.
Oh my God, we didn't even touch on the people who know when the certain provider.
Okay, guys. All right.
Thank you so much for listening to this Cuss and Discuss. This was awesome. Thank you for letting me vent. If it helped you, awesome. If it didn't, I don't care. If you want to respond,
tell us your real
yeah, if you want to respond to this show, please respond because we're on all the socials. We have Facebook, we have Instagram. We are close to getting X, possibly TikTok.
Yes, TikTok. I'm kind of excited about. I really need to work.
That'll be fun.
I'm gonna work
because I think we can sound clip shows and do all that. We're learning the thing. Great. Yeah. Like, listen, we are Gen Xers and electronics are no bueno.
Yeah.
So we're getting there. If you have information, comments, feedback, positive or negative,
yeah,
we absolutely welcome it. Again, this show is for you. These Cuss and Discusses, the topics that are coming out have come from the people that we have already talked to and kind of interviewed and gotten some feedback from on what they want to hear.
And we had topics planned that we've skipped just because something came up. And it was like, okay, this is something we need to do. So, I mean, we're open to topics. We're open to everything. By the way, Unhinged Essentials, Facebook name, Instagram name. We're on all the podcasts, or we should be on a lot of them. I'm not going to say all, a lot of them.
Every major podcast show is hosting us right now.
And some that I've never even heard of, so that was pretty interesting. Yeah,
So we've hit coast to coast, so we know we're covering it. Anyways, we're here. We love you guys. Thanks for listening to another Friday episode of Cuss and Discuss. See you next Wednesday and Friday.
Love ya.
Hugs and cuddles.
Kisses.